what we're seeing on the COVID case front, rising by 40%. That's the number of COVID cases in the past week. The U.S. now averaging 119,000 new cases a day. We want to bring in Anjalee Khemlani for the latest on all of this. And Anjalee, when you take a look at the rising number, the fact that we have seen several days in a row now with more than 100,000 new cases, where are we seeing the biggest spike in these new cases?
Right, Shauna. So we're seeing it pretty spread out. Honestly, there are some pockets in terms of cities around the country, as well as some states. In North Dakota and South Dakota are getting a lot of attention for their daily case count. But broadly speaking, we know that more than 100,000 cases per day for more than a week, as well as more than 60,000 hospitalizations reported. And that, of course, is really concerning because, as we know and as we've seen from the first wave, when you get an increase in hospitalizations, that leads to, unfortunately, an increase in the death toll, and that hasn't picked up as much just yet. And while over the summer we did see some sort of stabilization in that number because hospitals have done a much better job of treating patients, there are more tools in their toolbox to be able to treat them, there is a fear over those rising numbers as well. So that's where it stands in terms of the numbers. Now, of course, this is also leading to some states, some municipalities taking on the role of having some sort of strategy to really address this. We just learned that Chicago is implementing a stay-at-home advisory, of course, pointing out that that's not an order, but an advisory for 30 days for its residents. We know that in El Paso, Texas, there's also a concerning count over there in cases, and they too have implemented a curfew until December, and that's also causing some uncertainties and some issues. And so while there hasn't been really any conversation about a national lockdown, we are seeing these pockets around the country looking at curfews, looking at addressing capacity in some cases. And these are all some of the strategies that health experts have long said should be able to, along with masking and social distancing, help to curb the outbreak. But if in large part the country is not participating in those strategies, we're going to continue to see these numbers rise.